I'm Karen and this is your B12 video. In this video, we're going to review how to store your B12, how to draw it up, and how to dispose of it correctly. B12 is a medicine that can give you energy. You're going to take it once a week and then possibly every 2 to 4 weeks as we discuss at your follow-ups. It's important to store it in the refrigerator. You're going to take your medication, and then you always need to make sure that you wash your hands or use hand sanitizer. You're going to pop the vial, or the top off of the vial. You're going to swab it with an alcohol swab every time, like so. Then you're going to take your syringe and your needle. This is a 100 unit, 1 milliliter syringe, and this is a 30 gauge yellow needle. You'll use these every time. You're going to take your syringe and your needle and you're going to bring them together and screw it together like so. Okay. Then you're going to take your syringe and you're going to pull it all the way back to the 100 unit mark right here. And you'll know this when the bottom of your stopper is at the 100 unit mark. Then you're going to take your syringe and you're going to stick it into your vial like so. You're going to depress the syringe and put all of the air into the vial. This will help it fill easier. Then what you'll do is you'll turn it upside down and you'll pull back all the way back to the 100 unit mark, just like you did before. Now it's important to remember that all B12 is pink, and that's how you know that it's different from other medication. Some terzepatide compounds are compounded with B12, so this may not apply to you. Sometimes it will take a little bit of time, so just be patient with it. Okay, we're just filling it up until that 100 unit mark. Almost there. Perfect. So now that your medicine is filled to the 100 unit mark, you're going to remove your syringe, and then you're going to flick it like all good nurses do, and you'll flick the air out. It's okay if a little bit of medicine gets out, then you'll just shake it off. Now what we're going to do is inject the medication into your shoulder. So you're going to take an alcohol swab. And you're going to find your shoulder bone, and you're going to go about 2 to 3 finger breadths below the deltoid bone right here. So you're going to swab it. Then you'll take your syringe with 100 units of B12. Remove the cap if you recapped it. Then you'll just stick it straight in. And then you'll depress the syringe. Like so. Remove it. It's important to not recap your needle. You can also rub it to help with any tenderness after. Then, with your syringe, you can dispose of it in a Sharps container or even a Gatorade bottle, and you can bring those to our office and we'll dispose of them for you. So just remember, for your B12, you want to keep it refrigerated. You're going to do 100 units or 1 milliliter. It's always pink. You're going to inject it into your shoulder. Remember to use alcohol, and always dispose of it in a Sharps container or Gatorade bottle and bring it back to our office after it's full. Thank you for watching our B12 video. As always, if you have any questions, please don't hesitate to reach out to our office. You can call or text us at any time.